Hey guys, welcome back to the channel. Today we're going to talk about hip mobility and more specifically hip extension mobility and what a limited amount of that would look like as a self-test and some things to do about it. So if you have limited hip extension specifically, it could end up affecting a lot of your workouts. It basically is needed for every athletic type of movement, every weightlifting movement. You wouldn't have as much power for things like running and squatting, climbing stairs, basically all of those things that lead to generating power from our hips. We need hip extension to do. And it also can lead to low back problems and pain if the limited motion here gets transferred up the spine to the low back. So first of all, what is hip extension? It's the motion of our leg going straight backward, extending our hip like this. So an easy way to test this, and you may need a partner to look at this for you, but an easy way to test is to lie on your stomach like this, and then keep one leg straight out like it is here. And then with your testing leg, you're going to, with the knee straight, bring it straight up in the air, and you should be able to get that leg higher than your other foot. It should be able to totally clear your other foot. If it can't get much higher than this without the knee bending, then it may be a problem with a hip extension. And there are several ways you can go about stretching that motion. One of the easiest ones that doesn't involve any equipment is one that we use quite frequently for hip pain or limited motion, which is repeated extension. So it looks like this. You'll want to have the leg that you're stretching will be down, and the other leg will come up into this half kneeling position. Now from here, you're going to essentially lunge forward, but we don't want to just move our trunk, we want to extend from the hip. So bring one hand to the back of the pelvis and on our hip here, and as we push it forward, slightly lean our trunk backward. And you should get a very good stretch in the front of the thigh, maybe even somewhat into the groin. As you lean forward, pressure on, pressure off, pressure on, pressure off to create that pressure here at the hip. In some cases, we have to add to this where we have to preload the hip into a certain other rotation. So instead of the back leg just being straight behind you and going straight forward into pure extension, we may have to also add internal rotation to that more commonly. So before we get started, we preload the hip into internal rotation by moving our back foot out to the side, away from our body, and now our hip is already into internal rotation. If you do this correctly, even from this neutral position, you should already feel some tightness inside your hip. Now from here, you would still do the same motion going forward into extension, but you probably will not be able to go as far because we've already rotated the joint into internal rotation before we moved. So it's probably going to be tighter, but possibly more effective of a stretch. And lastly, and less commonly, we'll use external rotation by bringing the back foot inside and then also extending. Not as commonly used or needed, but is also a possibility, just depending on the case and depending on where the limited motion is inside the hip. So a couple ways to test this motion. And then if it is limited comparatively side to side, or if you have hip pain, then there's some repeated movements here that you can try, and you don't need any equipment, just maybe some kind of soft surface to put your knee down on. Otherwise, very easy to do at home. And you would do several repetitions throughout the day in order to improve the motion, and then always retest against your leg that's not painful or limited to see if we have improved compared to where we started. So thank you guys for watching the video. Make sure you like and subscribe.